And immediately after she started middle school, I noticed she wasn't washing her hair. She was wearing long sweatshirts. And in San Antonio, Texas, it's hot all the time. She played sports. She won't play sports. She stopped hanging around friends that she's known since kindergarten. And one day at work, I got a phone call that I needed to pick her up because she was cutting herself. So I rushed there, got a doctor, thinking that I was going to go to the doctors, they were going to give me a diagnosis, medication, and it was going to be better. It was going to be okay. Well, it doesn't work like that. The doctor has to evaluate your child and get a referral. And she lost a lot of friends. I lost some friends. But we kept going. We're still going. So she sees a therapist and a psychiatrist for ADHD and severe anxiety and depression. I don't know if I said she has ADHD, and we're going through the process of seeing if she has mood disorder. Some days it's hard because I just want her to be okay. Some days it's hard because you don't want to tell your friends what's going on. It would be easier to say that she has the flu, we can't go out, or, to cover up the scars. But I think that the more that I talk about it, the more that I let her talk about it, the easier that it gets. And that I hope that someday she feels good about herself and comfortable that it's okay to go get help. It's okay that we have to go see these therapists every week. Because she's going to need these tools later on in life as an adult to be okay. And there's nothing wrong with it. It happens to everybody. So I told her that she's important, and I yelled it at her. I care about you. I will fight for you even when you don't want to fight anymore. So that's what I'm doing. I want her to be okay. Don't be ashamed. Don't be ashamed. Everybody has a story. Everybody has a kid or a mom or an aunt, somebody, an uncle. It's more normal than we think it is. Don't be ashamed. Go get help. Go tell your doctor. If that doctor doesn't listen, go tell someone else. Be open, because holding it in, I think that's what hurt us. It held us back to get help sooner by not saying anything. So just talk. Keep talking about it. As a parent, as a mom, because I think sometimes dads don't understand or the spouses don't know. I think you feel isolated, and sometimes you fall into depression when you're trying to help your child. And, I think it's for the mom or the parent who's dealing with it needs to talk about it. I'm very shy. I don't like to talk to people, but if I can do it and it helps, then I think anybody can. Just talk about it. Talk about it with your girlfriends. Talk about it with your doctor, your child's doctor, because the parent has to be healthy and mentally healthy, because it's hard. It's hard to see scars on your daughter. And you're going to have to be healthy to make sure that she's healthy. And that's why I'm saying something. It makes me nervous because I don't want stigmatism, but I know part of it is saying, look, this is my life. This is what we go through. And if I saw this 12 months ago or a year ago, then maybe it would have helped a little sooner. You have to advocate for your children. You have to step outside of your comfort zone. You go to meet the teachers. You do all that stuff. This is just an extension of that. She is worth it. She is worth it.